Your doctor prescribed it. The pharmacist refilled it without a second glance. You've taken it every single day, for years, maybe even decades. And right now, as you watch this, it might be doing something to your brain that no one warned you about. Not a rare reaction. Something researchers at major universities have been documenting for years, while most family doctors still never bring it up in a 15-minute appointment. Today I'm counting down 9 medications, most tied to memory loss and dementia, but here's the twist. 2 of them are being falsely accused. Millions of seniors stop taking them out of fear, and that decision is endangering their lives. I'll tell you which ones and why. But first, number 6 on this list is the one that disturbed me most. It's handed out in nursing homes every single night just to help people sleep. What the studies show it does to the aging brain. Every family member needs to hear this. We'll get there. Stay with me. If you have a parent, a spouse, or a sibling over 60 taking daily medications, share this before their next doctor's appointment. What I'm about to walk through could change that conversation in a way that matters more than you know. Here's what most people watching this have never been told. The confusion, the forgetfulness, the moments where your brain feels slower than it should. Doctors and family call that aging. It's just getting older. But here's what research is now showing. In a significant number of cases, that fog isn't age, it's chemistry. Certain drugs block a neurotransmitter called acetylcholine, your brain's memory messenger, the chemical that helps your hippocampus form new memories and stay sharp. Block it day after day, year after year, and something changes in a way that isn't always reversible. This class of drugs is called anticholinergic, and they are hiding in medicine cabinets inside the most unsuspecting bottles. You would never guess from the label. Drug number 1, diphenhydramine. You almost certainly know it by its brand name, Benadryl. The little pink pill that stops allergy symptoms and helps you fall asleep. It's sold over the counter. It doesn't require a prescription. It seems completely harmless, something your grandmother might have in her nightstand right now. But a 2023 study published in the Journal of Geriatric Cognitive Health found something that should make every older adult pause before reaching for that box. People who use diphenhydramine regularly faced a 54% increased risk of developing dementia. 54%. The mechanism is the one I just described. It aggressively blocks acetylcholine, and in aging adults, whose natural blood-brain barrier has already weakened over the decades, it passes straight through into the memory centers. The practical answer here is a simple one. Ask your doctor about switching to a second-generation antihistamine. Loratadine is the generic name for Claritin, which treats the same allergies without entering the brain the same way. One conversation, one swap. But hang on, because number 3 on this list is something that doctors themselves prescribe, sometimes for pain, sometimes for mood disorders, and almost no one tells patients what it quietly does to the aging brain over time. First, let's get to number 2. Drug number 2 is one taken every single day by millions of women over the age of 60 for a problem that's embarrassing but extraordinarily common: overactive bladder. The drug is oxybutynin, sold under brand names like Ditropan and Oxytrol. And it works, there's no question about that. It reduces urgency. It lets people sleep through the night without getting up 4 times. But here is the problem hiding underneath that convenience. Oxybutynin is one of the most potently anticholinergic drugs that exists in common use. And it is specifically unusually effective at crossing the blood-brain barrier. A landmark 2019 study in the British Medical Journal followed adults over 65 and found that those who took oxybutynin for more than 1 year had a 49% greater risk of developing dementia compared to those who didn't. 49%. For a medication that's handed out almost casually, there are newer bladder medications, mirabegron being the most commonly recommended alternative, that work through an entirely different mechanism and don't carry this risk profile. That conversation with your doctor is worth having. It's worth having this week, not next month. Number 3, I want you to pay especially close attention here because this one is prescribed for 2 completely different reasons, which means far more people are on it than you might expect. Some people take it for depression. Others take it for nerve pain. It's called amitriptyline, and it belongs to an older generation of antidepressants known as tricyclics. Its anticholinergic activity is among the highest of any medication currently in common use. A 2015 study in JAMA Internal Medicine, one of the most respected journals in medicine, tracked more than 3,400 people over an entire decade. The conclusion was stark. People with the highest cumulative exposure to drugs in this anticholinergic category, a group heavily dominated by amitriptyline, had a 54% increased risk of developing dementia. And here's the critical detail for anyone taking it right now: this is not a fast effect. It accumulates. Every day you take it, the burden on your brain compounds a little more. If you're over 60 and amitriptyline is on your medication list, ask your doctor directly, is there a newer option for this condition? For depression, modern SSRIs often work equally well with significantly less cognitive risk. For nerve pain, alternative approaches exist. That conversation is worth starting today, not at the next routine physical 6 months from now. If you're still watching, good. Because what I'm about to tell you about number 4 is something most doctors are unaware of. There's a medication hiding inside a category that's broadly considered safe for the brain, and almost no one is flagging it. SSRIs, modern antidepressants, are generally regarded as relatively clean from a cognitive standpoint. Sertraline, fluoxetine, escitalopram, all considered brain-safe by most standards. But there is one exception inside that category, one that doesn't follow the same rules as the others. Drug number 4 is paroxetine, brand name Paxil. It is the only antidepressant in the SSRI class with significant anticholinergic activity, a fact that even many prescribing doctors don't fully appreciate. A 2021 study in Frontiers in Psychiatry found that older adults taking paroxetine showed early signs of cognitive decline at a rate 30% higher than those taking other SSRIs. 30% higher risk for a drug in a class otherwise considered safe. If you're taking paroxetine and you've noticed brain fog, word-finding struggles, or memory slips that have grown more frequent, this is a conversation worth bringing to your doctor. Switching to a different SSRI one without the anticholinergic profile is often straightforward, and it could make a meaningful difference. Now we're reaching the part of this list that hits close to home for a lot of people watching. Because drug number 5 isn't unusual. It's something hundreds of thousands of older adults take every single night for anxiety, for sleep, sometimes because their body has been on it so long that stopping feels impossible. These are benzodiazepines, Valium, Xanax, Ativan, Klonopin. For short-term use days to a couple of weeks, they serve a genuine purpose. But a 2022 study in the BMJ tracked more than 8,000 people over 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% increased risk of Alzheimer's disease. Benzos reduce what researchers call the brain's neuroplasticity, its ability to form new connections and stay adaptive. Months and years of use may be slowing the brain in ways that are hard to reverse. If you're currently taking a benzodiazepine, do not stop on your own. Withdrawal without medical supervision can be seriously dangerous. Ask your doctor about a supervised tapering plan. That conversation may be one of the most important you have this year. Because drug number 6, the one I promised to come back to, is one I need you to hear right now. Drug number 6, antipsychotic medications. Seroquel, Risperdal, Abilify. These were originally developed for serious psychiatric conditions, schizophrenia, bipolar disorder, and for those conditions, they can be genuinely necessary and irreplaceable. But here is what is happening on a widespread scale inside nursing homes and assisted living facilities. These drugs are being given to elderly patients who are simply restless at night, who are confused, who call out, who are difficult to redirect. They are being used off-label as chemical sedatives, not to treat a documented psychiatric condition, but to make behavioral management easier. A 2022 study in Lancet Healthy Longevity found that older adults given antipsychotic medications showed a 71% increase in severe cognitive decline within a single year. 71% in 12 months. The FDA has issued a black box warning, the most serious warning available, explicitly stating that antipsychotics must not be used in elderly patients with dementia-related behavioral problems because they increase the risk of death. Not the risk of dementia, the risk of death. If your parent, your spouse, or your sibling is in a care facility and receiving any of these medications without a clear, documented psychiatric diagnosis, you have every right to ask the medical team why. You have every right to request a different approach. That question alone could protect their life. Hit the like button if this has been valuable so far. And if you know someone who is taking any of the medications I've described, sharing this video might genuinely be one of the most helpful things you do for them this week. Because now we get to the 2 drugs I promised you at the very beginning, the ones being falsely accused. The story here is important, and it's one that might make you a little angry when you hear it. Drug number 7 isn't technically a single medication, it's a pattern that researchers call polypharmacy. Specifically, it's what happens when someone takes multiple anticholinergic drugs simultaneously. Picture this. A person takes Benadryl for seasonal allergies. They also take oxybutynin for bladder control. And they take amitriptyline for an old nerve pain issue. Each of those drugs carries individual risk. But together, they create what researchers call a high anticholinergic burden, a cumulative load on the brain's acetylcholine system that multiplies the danger far beyond what any single drug would cause alone. A 2022 study in the journal Age and Aging followed 280,000 people and found that a high combined anticholinergic burden more than doubled the risk of dementia over 10 years. 120% increase. And this is happening to people right now who have no idea because each prescription came from a different doctor who never looked at the full picture. This is precisely why the single most powerful step any older adult can take is asking their doctor for a complete, formal medication review, an intentional assessment of everything they're taking, with a specific calculation of total anticholinergic burden and a conversation about which drugs might be replaced with safer alternatives. That review alone could change the trajectory of what comes next. Number 8. And here's where I have to directly correct something you may have already seen. Proton pump inhibitors. Omeprazole, Nexium, Prilosec. Medications taken by millions of people for acid reflux, heartburn, and stomach protection. A 2016 study made headlines claiming that PPIs raised dementia risk by 44%. That headline went viral. People panicked. Many stopped taking their medication without telling their doctors. But here is what the science actually shows when looked at more carefully. Larger, more rigorous studies published in Gastroenterology in 2017 and the BMJ in 2020 found no credible, reproducible link between PPI use and dementia, None. The older study's findings almost certainly reflected confounding factors. People who needed PPIs often had other conditions that independently raised dementia risk. The drugs themselves were not the cause. That said, there is a real concern with very long-term PPI use, not dementia, but something adjacent to it. Years of reduced stomach acid can impair your body's ability to absorb vitamin B12. And a significant B12 deficiency causes confusion, memory problems, and cognitive symptoms that look strikingly similar to early dementia, but are completely, fully reversible with proper supplementation. Ask your doctor to check your B12 level at your next appointment. Not because PPIs cause dementia, they don't, but because a deficiency might be quietly mimicking it. And finally, drug number 9. This is the one where the misinformation may be causing the most real-world harm. Statins, Lipitor, Zocor, Crestor, rosuvastatin. You may have seen claims in viral videos, Facebook posts, health books that statins are depleting the brain's cholesterol and causing irreversible dementia. This is not what the evidence shows. The FDA has reviewed this question thoroughly. The global medical consensus is clear. Statins do not cause dementia. In fact, some research suggests they may protect against vascular dementia by preventing the small strokes that frequently precede cognitive decline. Now here is the nuance that the viral claims always skip. Some people taking fat-soluble statins, simvastatin and lovastatin especially, do experience brain fog, real, uncomfortable mental cloudiness. But here is what matters. It is completely reversible. Switching to a water-soluble statin, like rosuvastatin, resolves it entirely. If you're experiencing cognitive symptoms on a statin, ask your doctor about switching formulations. Do not stop your statin out of fear. The evidence does not support permanent brain damage, and stopping abruptly carries serious, well-documented cardiovascular risks. Let me bring everything together, because I want you to leave with something concrete, not just worried and unsure what to do. Here is what the research keeps confirming. Cognitive decline driven by medication is in many cases reversible. The word that changes everything is early. The earlier the cause is identified, the more can be recovered. If you or someone you love has been experiencing confusion, unusual forgetfulness, or creeping brain fog and they take any of the medications we covered today, please don't assume it's aging. And please don't assume it's permanent. Start with a complete medication review with your doctor. Use exactly those words. Ask about anticholinergic burden. If Benadryl is a daily habit, ask about loratadine. If oxybutynin is the bladder drug, ask about mirabegron. If paroxetine is the antidepressant, ask whether another SSRI would work. If benzodiazepines have been running for more than 3 months, ask for a tapering plan. These aren't radical demands. They're reasonable, evidence-based questions that any patient has every right to raise. And if you stopped your statin or acid reflux medication because of something you saw online, please discuss that with your doctor before it becomes permanent. Comment below right now and tell me, which medication on this list surprised you most? Was there one you or someone you love is actually taking? I read every single comment, and your questions shape what I research next. If this video gave you information that nobody gave you before, share it with one person in your life who's over 60 and takes daily medications. Not to scare them, to give them something they deserve. An informed conversation with the doctor who's supposed to be looking out for them. Subscribe if you haven't yet. I publish videos like this every week. And next week, I'm covering something that hides in everyday food and may be doing to your blood vessels what these drugs do to your brain. You'll want to see that one. Take care of yourself. I'll see you in the next one.